So I'm not sure how that works, but reminder. Latin. Oh, Latin. All right. Go ahead.
Good evening, everyone. I'm Ashley Hunter with Reminder. How many of you can relate to this picture with the multiple pill bottles? Or even maybe it resonates for a close family member or maybe a friend that you've heard of struggling with their prescriptions. This person has how many to put in, know when to take them. Unfortunately, probably, a lot of you out there, this resonates with you because 70% of our doctor's visits today end in a prescription, and most of those have a medication error. And in the United States, this is costing us millions of dollars because of overdoses, prolonged illnesses, and readmissions to the hospital. Therefore, this is affecting our loved ones. So I am here today with Reminder to offer you and your loved ones a solution. This is a web-based application for you and your family members. As you all know, your family members are probably becoming more and more spread out, but your loved ones are living longer. So if you're not able to attend that appointment, we have a solution for you. Someone can enter all of your prescription information ahead of time onto our web-based solution, and then it can push reminders out to multiple applications, whether that be your phone or an iPad or even just the computer email. The web-based or the mobile application is really important because when you're in the doctor's office, they ask you that annoying question, what are your medications? But it's so important because we're seeing more and more providers. So we have an aggregated list of all of our prescriptions, even when you're going to your specialty provider. And then we have the key dosage feature and a picture so you get the right one. Dosage, also important because we're oftentimes adjusting that when you're coming in for follow-up appointments. And then the second one is the pharmacy and doctor's office. Pharmacy, very important. Many of you today, we found out, are shopping around because you want to get that lowest cost. $4 prescription here, $4 here, but they're not always at the same one. So that way you have this all on your phone when you're out there. Our pricing model for this is that you'll have the free mobile application service, but there will be the online membership will be a service. Will be a fee of $49.95. This is important because your loved ones, the elderly and the young, are the ones that are most at risk. And we did find that there are competitors out there, but they unfortunately only have the iPhone and don't have that online collaboration that's so important to target this high-risk population. So our surveys that we did out there, we saw that adults are more and more becoming on the internet and also using mobile devices. So we offer this solution for them to be able to use the notifications and also collaborate with your loved ones. We have also made contacts with some of our providers in that, and we want to collaborate with them in the health systems that have a preventative enforcement. So we will be able to, down the road, take care of the self-entry data so it's more reliable because we know that's an error. So if you use Reminder, what we are able to do is increase compliance and give everyone in your family a peace of mind about your loved ones. Thank you.
Did you build a product to show anything?
Unfortunately, we had some issues with our developer, and so we just have those phases. We had a small team, so.
So right now, inside of kind of the model that you guys have, the patient would put in their own data.
Right, and then that's where we talked to some different providers and would be willing to work with them. And then hopefully we could further that partnership and then eventually be able to just have that upload of the prescription data.
So I think the idea is really brilliant. It's a really great idea. The one concern I would have externally would not necessarily even be around compliance, but it's what happens if somebody puts in the wrong data and someone ends up with the wrong pills and takes 5 instead of 1 and then they die.
So we would have a notification, and we also looked on the other ones that are out there that they're entering their own right now on just the mobile app. And that's also that they have a notification that you're not liable. But also entering it on the mobile app is a concern because you know how many times you type on your mobile app, get something wrong. So that's also why we want to have you enter it on the computer so you're less likely for error when you're entering it on a computer versus the mobile app. So we do kind of address that right away, but our goal is to, as soon as possible, get that automatic entry.
I'd suggest too an algorithm where, you know, it's checking for
Yeah.
doses and
Yes.
medications that shouldn't be taken together, and then have the doctor or the pharmacy actually upload that to
Yeah,
the
and
to
that's
the
our
file.
goal is to get there, but stage one would be at least get out there and then develop that partnership and checking it with the providers and get that relationship so we can automatically generate that.
How would you market it?
How do we market it? We market it through social media and make sure we're accessible, and then also through that relationship with the providers and our pharmacies and their word of mouth.
We talked also with some people maybe whitelisting the products or working with the insurance providers to put it in their systems and they brand it.
So that's the fastest route for
That's better.
distribution
Yeah.
without a doubt, and that's also
You know,
the safest
there's,
one.
I mean, two quick things that if you're really going to go somewhere with this. There's a company called Outcomes in town that you need to talk to. That's in a parallel universe, and you need to think about taking the idea to somebody like a Walgreens or some large pharmaceutical that would co-brand with you, that has all those data and feeds and understands the liability issues you're
Yeah.
going to deal with. Just because I think it'd be a faster path to market.
Okay,
Something to think about.
thank you.
We have time for one more. Do you guys have one?
Just a suggestion, same suggestion from Friday night. As you build this,
Yeah.
if you build this, buy the data. Don't try to
Yep.
scrape it from the FDA. That
Mhm.
data is junk.
Yeah.
I would buy
Yeah,
it from
and
the
that's
provider.
why originally too, to start with, we have been looking into grants for that cost to buy it, and also right away let them enter their data as we're able to build up that cost and get those grants going, because medication errors, if you can reduce them, there's a lot of grants out there for that, so that way we can get those costs.
Well,
Okay.
especially as you're hitting polypharmacy.
Yeah.
Polypharmacy is a critical problem for many patients.
Yep.
So
One thing you might-
Outcomes has all that data
Yeah.
privately here.
Okay.
One
Thank
thing you
you.
might want to do is think about building or connecting with some hardware that would hook to this, so that it would just meter out and drop the appropriate pills into a cup or whatever for the person to take at the intervals.
Yeah, that's a great idea. Thank you.
All right. Thank you very much, Reminder.